Hello and welcome to YouMatter. Hello, welcome back. This is episode 14 or session 14 of YouMatter. And this is a follow-on episode from my session 12 with Thow, where we started talking about failures in physiotherapy and how we handle those. And it was a podcast that generated a lot of interest, and it felt like Flic and I had just started to have a conversation that had some more legs in it. So I've invited some other guests. Felicity's come back, and I'm also going to be joined by sports therapist Katy Stevens and Martin Christensen, physiotherapist from Norway. And so the session is a panel discussion picking up on some of the themes that Felicity and I discussed in the first episode and taking those a little bit further. So sit back and enjoy the episode, and I will see you at the end. So hello and welcome to episode 14 of the YouMatter podcast. And today is a panel session. It's actually a follow-up session. So 2 sessions ago in episode 12, some of you may have heard my podcast with Felicity Thow, with Flic, and we talked about failures and how we cope with them in a professional capacity. And during that episode, Flic and I covered all sorts of areas, but things that stand out for me were that it was based around a scenario where Flic was feeling a certain amount of shame and what she saw as a failure, having missed in her eyes a ruptured Achilles tendon, and the feelings that she felt around that. We talked about that quite a bit. We touched on perfectionism and how that may or may not be a higher than average trait amongst therapists, and whether that relates to how we were at school. We got onto the fact that we were both head girls and some of the things that may have gone into the programming that led to that situation. And then a really interesting part of that discussion for me was, Flic, you made reference to this idea of almost accepting the punishment that you justly deserved because you had made such an awful mistake. And I know that that's something that was picked up quite a lot on social media, and it's certainly for me has led to other discussions. And another thing, towards the end of that session, we were talking about how do we manage this? What do we need? And Flic, again, I think it was you that came up with this lovely idea of, what we need is a society of average physios. And then lo and behold, Martin Christensen, who's one of my guests today, took up that mantle. I'll get him to tell you more about this in a minute, but Martin had already been dabbling with exposing failure on Twitter, had a bit of a following there, and he took up this mantle and went away and formed the Facebook group, which I believe is called the Society of Average Physios and Failures. Is that right, Martin?
That's correct. Right?
Yeah. And so I thought it would be great. There was obviously so much interest, and it felt like there was further to go with this discussion. So I've invited 3 guests on today. I've got Felicity Thow back, I've got Martin Christensen, and Katy Stevens. Now, we've all agreed just before coming on air that we're going to try and do this with no edits. Now, there's a practical reason for this, because it's Friday and this podcast is due out on Sunday, and so it needs to be edited quite quickly. And so the least edits, the better. But also, in keeping with this idea of embracing failure, we're just going to go for it. And barring tech failures, if we say silly things, if we stumble over our words, if there are blank spaces where we're thinking, we're going to leave all that stuff in. And from a personal point of view, that gives me a great get out, because one of my my things is I am terrible at remembering people's names, their businesses, what they do for a living. And I get a bit of a panic at this stage in podcasts. So I'm going to let myself off the hook and hand over to my guests and ask them to introduce themselves, and then say a little bit about what failure means to them, particularly in a professional context. So Martin, having mentioned you already, I'm going to introduce you as the forefather of failures, which I believe is the name that you have fully embraced. And can you introduce yourself and let us know what failure means to you?
Yeah, all right. Thank you, Joe, for having me. Forefather of failures is the word, the name I'm quite most happy with, but in official terms, my name is Martin Christensen, and I'm a physiotherapist from Norway. I work in private practice. I run my own clinic, or sort of on a small island in the middle of Norway. So that's what I do. And as you said, I've dabbled a little bit on Twitter about failures and mistakes, and with my Friday confessions and everything. And to your question, what is failure to me in the clinical sense? Now, I'm working inpatient clinic, so this is a fail. Keep that in mind. And I was thinking about this, and I think failure for me is when I let my own prejudgments, my own biases, my own certainty, or my own security in knowing some things overshadow the info I actually get. So when I'm not listening too well, diagnostic overshadowing maybe, and I keep getting into the things I can do something about and pushing away the things that doesn't make sense in my suspicion. So that's the failure to just take a step back and get the info is probably the biggest clinical failure for me. Yeah,
that's really interesting. So that sounds almost like a failure in the process rather than the outcome.
Yeah Shit on the outcome. It's the process that matters.
Well, straight away then, an unexpected answer to that question. So not what is the result of that process, but just what I'm hearing there is almost that you in your words, you've gone for the easy option of your biases rather than listening and taking on board this slightly uncomfortable stuff which doesn't fit into an easy process. Oh, I love that answer. Thank you. Who would like to go next? Should we go to you, Flic?
Yeah. So I'm Flic, Felicity. As you introduced me, I was in the podcast about this previously. I'm a physio and I work in private practice in my own clinic as well as being on the Physio Matters team, and then also working for the Flip and Pain public health campaign too. And in answer to that question, what does professional failure mean to me? I was thinking back to kind of what I meant when I said to you, this feels like I failed in this instance. To me, it's when I feel like, and it's a very visceral feeling as well, that I've let someone down. And I kind of trace that back because you think, oh, well, in this instance, I feel like I let this woman down. And when you trace it back, you think, oh, it's because you care about your patient so much, which of course I do. But when I really think back, follow that line back, it's the feeling is, oh, you won't respect me anymore, you won't like me anymore. And I think that's why I then didn't want to tell anyone else, because what if they don't like me as well? What if they completely lose respect for me? So it is that feeling where the bottom falls out of your stomach. It's a real sensation that, oh no, the wheels are all going to come off now because of this failure.
So going 4 steps ahead to this will mean.
Social rejection, yes.
Yeah, and that reminds me of your comment in the first podcast where you'd had a bad test result at school, and it was almost a surprise to you that your parents didn't throw you out of your house and still allowed you to live with them, even though you had got.
It's shocking, isn't it? That they are so understanding.
And that's so honest, Flic, to admit that yes, there's that feeling towards letting the patient down, but then if you're brutally honest with yourself, the rejection of your peers because you have been wrong or not clever or not right,
something daft,
is overriding that. And I think so many of us would, now you've said it, agree with it, but how many of us would be honest enough to actually have said that in the first place? I love that. Thank you. Katy Stevens. Would you like to introduce yourself, Katy Stevens?
I will. So I am Katy Stevens. I am a graduate sports therapist. I work as a university lecturer 2 days a week, and then I'm in private practice, my own private practice 3 days of the week. So when Joe got us thinking about failure and what that kind of means in a professional setting, I thought about the conversations that I'd had with Joe around kind of perfectionism. And I think for me, anything that is below perfection is a failure, and it's almost on a spectrum of failure. So some can be just a small failure, whereas other things can be a larger failure. And unlike Martin, for me, failure, I deem it kind of the outcome rather than the process to getting there. Once the outcome is a failure, I may then look back and look at my process and go, yeah, the process was a failure. But the first thing I notice kind of in professional failures is the outcome. And then I thought about what actually is like a successful perfection, what is perfection to me. And I think it is literally that perfect outcome. So if a patient comes in and says, you know, I want to be running for the end of April, I've got a half marathon to do and the knee's really playing me up. If I don't get them running that half marathon, I feel as though I've failed them. And a lot like Flic, actually, really interesting. It's a feeling. So it's that you've let them down, but more so you've let yourself down, and that people are going to dislike you for it. So I think that's really interesting.
So this process, Katy, if you've got that that runner or somebody that wants to complete a sporting event, would that have been an outcome that you had agreed together? How does that come about?
So I think that like from your first initial assessment, you think about after you've kind of got that diagnosis and what's going on and how you're going to manage it. Often a patient will say, you know, but I still want to be able to run that race at the end of April. And in you'll have that very honest conversation that actually that's probably not going to happen, because, you know, the type of injury that it is, healing times, X, Y, and Z. You have a very honest conversation, but still for me in the back of my head, I'm thinking, yeah, but the ultimate goal is to be able to get them back for the end of April, right. Even though it's not realistic. So even though I've made it very clear to the person that I'm working with that actually that isn't realistic, in my own mind, I'm thinking, yeah, but we can really work towards that, which is perfectionism, because I want to be able to do, you know, and I'm aware what I'm going to say isn't strictly true, but to me in my brain, I'm thinking that. So I'm thinking I want to do the best for this person, and the best that person is being able to get them running that race that they really want to race. And I know in a real sense that actually it's not the best for them. The best for them is being, you know, pain-free, functional, and getting them back to the thing they love, however long that takes. But yeah, perfectionism for me is getting them back to that thing that they really want to be able to do as soon as possible.
And what I'm hearing there, Katy, is that you've made an agreement on what's a realistic expectation, but then your perfectionist wants to override that. Probably not in a verbal agreement with the client, but you're like, but we can go one step better. Yeah. And actually, my clinic has a tagline that says exceed your expectations. So I wonder if we just straight away, you know, there's a subtext there that, oh yeah, you tell us what's best and we'll go even better. And yeah, I hadn't really thought about that from a perfectionist point of view.
Yeah.
And actually, you've made me think, so obviously my world is much more around coaching these days. And in coaching, there's masses of emphasis on every single session of partnering with your coachee, so in the clinical sense, the client, as to what is a good outcome for that session. And, you know, if the outcome is, I don't know, I want a 45-year happy marriage, then, you know, you're not going to get that by the end of that session. And so the next question would be, and what would be a good step towards that at this session? And I've never really used that kind of language in as a physio, but, you know, maybe a bit more time having those conversations with clients, and, you know, their expectations, it sounds like, will often be more realistic than ours, but we don't verbalize it and actually agree where we're going by the end of that session or the end of this episode of treatment. Interesting. Do any of you do that? Is that something anybody does already?
I do the bare minimum, so I won't expect anyone else to.
In terms of agreement setting.
Yeah.
We're such doers, aren't we? It's like, oh, right, let's get on with it then.
But it's interesting to hear that Katy had so opposite views of failure and successes, and the focus on outcomes, and I focus on the process. That's quite interesting how different we can be in all of that, because my only focus is on the process, and I believe that if the process isn't right, the outcome isn't right. And so I always work with, okay, what are we doing today? What are we trying to do this week, this month, and set parameters of when can we go on? Because if my process isn't good, then I know that we probably won't reach the outcome we want. So I don't consider outcomes as a measure of success at all, because we also know that it's quite different. There's so many factors that it comes into play, and its pain is so multifactorial. We know that injuries are a lot more complex than not being able to tolerate the load. So healing times, gender, age, social economics, demographics, and all these things. So my focus has always been a process, but it's good to hear that someone just outcome measures. Yeah.
And actually, Martin, you've just reminded me, so Tom Jessen was going to be on this panel today. Unfortunately, he's not very well, but Tom's given me permission to refer to a newsletter that he wrote after listening to Flic's podcast last time. And Tom, lots of you will know, has done a lot of work on Cauda-Equina syndrome, and his newsletter was around the nervousness he feels, and he recognises that so many of us feel around the point of making that referral for a scan, and is it the right thing, is it the wrong thing? And he says in his newsletter that he gets this vision of the experts in hospital rolling their eyes as another negative result comes out, and oh, we knew it's going to be negative, of course. And then he makes the point that we need a lot of negatives so we don't miss the positives in that particular clinical scenario. But then in his newsletter, he also makes the statement, which I love, that our responsibility is to engage in good decision-making processes rather than the outcome. So in the case of Cauda-Equina, the outcome quite often is going to make us look wrong. And yet if our decision-making process to get to that point was sound, we haven't failed. I really liked his take on that. And that sounds parallel in some ways, Martin, to your thought processes around failure.
Yeah, it sounds like it. Yeah.
I think it makes me reflect. It's really interesting to hear that, because it's right. Yeah, when I did my postgrad work, one of the assignments was about litigation, and so I looked at Cauda-Equina because it's such a topical physio thing. And when you read the cases of Cauda-Equina where people have or haven't been awarded compensation, obviously their outcome was terrible because they're seeking some sort of compensation. So their outcome is often permanent disability, permanent incontinence, loss of livelihood. But not everyone was awarded compensation. In fact, some of them were quite shocking. You think, gosh, this person wasn't, they were sat as an inpatient reporting, I'm suddenly not going to the toilet. They weren't scanned for any number of reasons, but they weren't awarded compensation, and the doctor concerned wasn't given any there wasn't any consequence for that doctor, because they then said, actually, it was such a fast moving thing that if you'd scanned them anyway, the potential was that this outcome would have happened anyway. And I thought, God, that's interesting. I think it reassures me that yes, you can do everything right, and there can still be, unfortunate for the person, of course, but you can still have that outcome. And I think it was the process that failed me, that I failed the person. It was the assessment process. It was me not tagging on it. Oh yes, let's have a look at this at the end of your session about something else. It was the process.
Yeah, and Martin, you made reference in that process to whether you listen enough. And I really like, there's so much emphasis now, isn't there, with motivational interviewing and a lot of the stuff Flic coming out of the pain world, just taking that little bit longer to actually listen. We think we're good listeners, don't we? But I wonder whether sometimes we are good listeners for the nuggets of information which we know fit a pattern. I've said this on podcasts before, but I remember telling someone that when I was doing my coach training, that I was going to find this difficult because my whole life had been a process of listening to someone and gathering these significant pieces of information until I could put them all together and present a diagnosis, rather than, as you say, Martin, listening for the things that actually are a little bit annoyingly inconsistent with the pattern and a little bit quirky, but actually might be the things that really get us where we need to go.
Yeah, exactly.
Taking that a little bit longer.
Those snippets. I have an anecdote on that, actually, if you want to hear. Okay.
Yeah, go.
So first failure up, isn't it? Right.
Do we have a scorecard at the top?
This is not as bad as Flic's failure, but
yeah, fair enough.
Yes, that is just terrible physio. Right, so there was a middle-aged man referred to me with shoulder pain, and he had quite a typical subacromial shoulder pain pattern. We worked long hours, no sleep, had a period of 2 months previous to the pain debut, worked more with his arms and above his head than he was used to. And the test came back and everything like that was positive, and strength.
Martin's just done a Hawkins action on screen.
Yeah, sorry. Really good one.
Yeah, it was excellent.
Yeah, excellent. 100 points. So everything fits into that, rotator cuff related pain or whatever you want to call it. But he was unfit. He was overweight. He smoked. He drank, and he had diabetes or beginning of one. And his blood pressure was not good. But me, what did I do? Rehab the shoulder.
Yeah.
Right. So I started with everything was right, didn't pattern, and we worked on shoulder exercises. It goes 4 or 5 weeks. Not feeling any better. Itchy. It takes time. It takes time. Just slow down. A couple of weeks more. Not feeling any better. Oh, it takes time. And then continue to do this for weeks, actually, because I've been taught that things can take a little bit of time. Then one day I get a call from him, and he said, "Hi, Martin." Hi. Yeah, I'm in the hospital. All right. Okay. Yeah, I had a blood clot in my lungs. And when they fixed that, I collapsed. I was working, I collapsed, went to the hospital. They found it. They fixed that. Now my shoulder pain is gone. Do you still want me to come in on Tuesday? It's gone. Yeah, it's gone. You sure? Yeah, sure. You don't need to come in. Just go on. Yeah, it's cool. And for me, I was so preoccupied with dealing with something I knew how to deal with that I just passed by every other thing that didn't look good.
Yeah.
Every other general health issue.
Yeah. The thing that was screaming because it's the world.
Yeah. And also screaming high.
Yeah.
As well. And so that's a real failure, I think.
Yeah.
Then my whole process went AWOL. But I still got a good outcome, didn't I? Shoulder pain gone.
Absolutely.
And he wanted to come back.
Yes. Yeah, if you'd said yes, would he have come back for more shoulder rehab, I wonder?
Yeah, we had a good relationship. Really good relationship. See, he was quick also to, I'm not blaming you. You couldn't have known. So the phone call was also him for 20 minutes trying to reassure me that everything was good. So, yeah.
Do you see that as a failure or an interesting case?
I see it's as a failure of not listening or being preoccupied with what I knew. So that for me is a failure. But treating out as I see it as a failure and a learning experience. Of course it is.
Yeah. So that leads quite nicely into one of the reasons that I invited Katy on the call, actually. So Katy, I know she doesn't mind me saying, has been a coaching client of mine. And we had a conversation about this after the last podcast, after Flic's podcast. And we got talking about the things we do to ourselves after a perceived failure. And Katy's got a little anecdote. In fact, we both shared an anecdote, didn't we? But Katy, could you mind sharing what you shared with me on that coaching session? Because it spoke so well to our own reactions to, I'm going to say, what we perceive as a failure rather than a failure.
Yeah, so Flic, what you said with yours was really interesting, and it really kind of got me thinking about how I respond to what I deem a failure. And I think you said kind of it felt like she was too nice to you afterwards, and she reassured you, and you felt like, no, like you should sue me. And I very much kind of get that feeling as well. So when I feel like I've done something wrong or I've missed something, I would go as far to say as I punish myself. So I think when we were talking, Joe, it's little things. So if I'd missed, let's use, I don't know, an Achilles rupture for an example.
For a random example.
Yeah, just a random example.
The worst you can do. Yeah.
Of course. I would then probably spend 3 hours of my evening like reading journals about Achilles ruptures to make sure I'd never miss something like that again, and cancel any like dinner plans or social events I had that evening, almost to say, Katy, you don't deserve to go out and have fun with your friends. Like, you need to put this right, and in order to put this right, it's going to be about you learning to make sure this doesn't happen again. Even though it could have been, you know, something really simple, and something that anyone could have missed, I would still go away and then kind of, almost punish myself. And I said to Joe, that is almost what I'm doing. So it's even things like one weekend not so long ago, I can't even remember what had gone wrong. I'd had a bad day. And I thought to myself, I'm not going to go horse riding this weekend with my friend because I probably need to do some reading around that, or I need to listen to another podcast about that. And there have been times since graduating where I've, booked onto CPD events and things, because I think, well, I'll spend my money to become better at that so that I don't do that or make that mistake again. I don't need to spend my money. I'm realizing this now, or read for 3 hours. Actually, it was just a genuine human mistake, and we all make them. But yeah, certainly kind of punishment for me has been something that I've seen throughout my professional career so far.
I find that so sad and fascinating when Katy told me that, and it made me really thoughtful, because I spend an awful lot of my time at the moment trying to encourage clinicians to take better care of themselves, and then this was almost, let's go back and make sure we're not actively harming ourselves before we even think about care. And Katy reminded me of a situation which, if I'm honest, Flic, throughout the whole of our podcast, it was in the back of my mind to share this anecdote. And I didn't, because the stakes are high. And Katy's situation reminded me of it. And I'll share it without detail, because it was nearly 20 years ago now, when I was in New Zealand, and that you shared a story in New Zealand, Flic, and it was in my mind then. Somebody actually lost their life in this scenario. And it is something that, I'll tell in a certain way, because, people are still affected by this situation. But I was 20 years ago, quite a young physio. This was part of a whole traveling experience for me. I was in this particular town for a little while, and this incident happened. And from caring from me point of view, it was managed beautifully. I was phoned that very same night by the paramedic that had dealt with this person, and as far as they possibly could, reassured me and described the sequence of events, which actually meant that I was just the unlucky person to be in the wrong place at the wrong time when this thing happened. However, what I did next in hindsight is really interesting to me. So I had some time off and I took myself off to walk one of the trails. And it was Nelson Lakes. Flic, you probably know that one because I know you've done those walking trails. Now, some of these walking trails around New Zealand are really busy. You know, you can't get in the huts at night because everyone's doing the same trek. You might have heard of the Milford Track and the Route Burn. Those ones, absolutely tourist trail. Nelson Lakes at the particular time of year I decided to do it is almost deserted. So I went off, a 20-something female on my own, and I walked this trail for 3 days. And I stayed in huts. 2 of the nights, nobody was there at all. And the other night, there was a single man in the hut with me. And I look back and, I mean, goodness, if my daughter told me she was doing that now, I would have absolute kittens. And I was in quite a strange mindset for those 3 days. You know, understandably, this huge thing had happened. But, you know, I can honestly now look back and go, yeah, there was an element of, right, come and get me then. You know, that was really bad. So whatever happens in these next 3 days, I'll take fate because, you know, I'm that bad that I deserve it. And, you know, sorry to put this podcast on a bit of a downer, that's a very heavy situation. But, you know, when Katy described that, I thought, God, yeah, you know, that's an interesting thing to think about, what we do to ourselves when we've been judge and jury on ourselves from the moment, haven't we? We've decided it's a failure. Then we start dishing out the punishment, you know, then there's probably a process afterwards. I really hope these aren't common stories, but Katy just highlighted an angle for me that, you know, was interesting as a coach. And, you know, first do no harm is a medical term, isn't it? And I really thought, yeah, we need to be looking at that from a personal perspective. So yeah, sorry to bring it down to that with that, you know, fairly somber anecdote. Martin, you just unmuted yourself. Is there something in your mind with that?
Yeah, it threw me off guard. Yeah, that's quite a story. But what we're talking about now is the feeling of responsibility, isn't it? And I think that's quite common, to feel that heavy, that dread really of responsibility. Yeah. And it can get you quite down, can't it? So, but I think but my main point, especially on Twitter, is we need to be more honest and open about these things, because it's common. You said, Joe, you said you hope it's not common, but it is common. I think you all experience it. And we need to realize that we're not alone in this. People are feeling. There are people finding ways to deal with it. There are people finding ways to make it better. We are discussing it, but it needs to come out and show itself, because this responsibility it's heavy. It's really, really heavy. And I think that we need to understand that we all feel it, and especially patients need to understand, because it's heavy. Being in pain is the whole life, but when also patient comes to see me, I think about my patients every day, all day, sometimes in the night, not in the bad way, of course, in the supporting way.
Thank you for bringing it up again.
yeah. I had to. There was an opening, I took it.
Yeah.
So yeah. Well, do you see my point? Yeah.
Yeah. Flic, where do you stand on this?
It's interesting. Can I ask you about that experience? Like, what your feelings were? Was it a feeling of, okay, well, if something happens, then I deserve it, or was it like? Because I'd be thinking, well, you know, if I get knocked over by a bus, at least everyone, you know, nobody else will have to suffer this terrible physio again. And they might even forgive me for making a mistake, because, of course, it'll be this is morbid, isn't it? Because there'll be a memorial. It's like, oh, well, at least I'll never have to be in this responsible position again. I feel like that's how I'd be thinking.
It's a good question, and bear in mind this is nearly 20 years ago, so we know how accurate memory is, and you know, I'm trying to remember something which, if I'm honest, I blocked. Coming back from there, I went back to work, I carried on, and I numbed basically for, I think that's how I got through that. So my memory of it is a bit hazy. I would guess that what I was feeling was that I couldn't cope with the feelings, and therefore any way out of it I would take.
Yeah.
Obviously I had to take the route of through it, because I didn't get murdered in my bed at night, and I had to deal with it. And yeah, but it's been, because I don't know, maybe it was the age I was and the stage of life I was at, numbing probably was the safest option for me at that moment. I was on my own, quite young, the other side of the world from my family and my support networks. I basically had to get through that. And so numbing was probably a fairly sensible survival strategy. But I would say over the years, things have happened that have definitely triggered that's the memory of that process, and it's the feelings. And I'm not sure that it was kind of even as far as nobody else will suffer, it was just, I won't have to feel this anymore.
I think that's what I mean as well. I think that's where I'm coming from.
So what would it look like in this utopia where we don't have to deal with feelings of failure? What would, in Pollyanna physio and sports therapy world, what would it feel like to work without fear of failure? Anybody feel free to answer that one.
Well, I think Martin has revolutionized the world of Twitter for me, because he has been so honest about how most of us feel. We're just too frightened to say it, or too ashamed to say it. So I have had regular conversations with colleagues about some of the funny things you've put out on a Friday in your confessions, and we're like, yeah, it's something we've never talked about until we've read it and we've had a little giggle about it. And then we've kind of said to each other, yeah, like we do feel like that, and that does happen. And so for me, those conversations, just actually having those conversations, because at the moment, the world of social media, as we all know, it's all filters and sparkly glitter. And everyone wants everything to look perfect, and it's not. We don't live in a perfect world. And so mistakes are there to be learned from, and actually if we don't share our kind of mistakes and how we've learned from them, we're not helping each other. So for me, if we could just start all being a little bit more honest and communicating that with one another, instead of hiding behind it, I think for me that would be just the best start. Yeah. Martin,
I'm interested actually, because I love your I hadn't followed you so much on Twitter, and I've followed more on Facebook, and I love the humor. I love your initiation questions. So if any of you haven't seen this Facebook group, you basically, if there's any sniff that you might be expert on something, you're not actually allowed to join. And I love that. And Martin's really good at sniffing out any whiff of expertise and jumping on it straight away. And then I think therapists are quite funny. There's a load of comedians in your group. I have a right old chuckle when I read it. I just wonder, Martin, whether that humor is really helpful. And like we've done on this podcast, you cannot stay in the pits of despair and doom and get through this stuff, and we need to lift it up. My question to you though is can there be too much humor, and is there any point where you would want to move from that, or move the conversation into just how you beautifully did with my share there, and just you weren't smiling when you said, no, actually this responsibility is really heavy and we have to acknowledge that. Where do you think, or do you have any thoughts about the balance between humor and just calling it when it isn't great?
Oh, good questions. Well, favorite answer, it depends, doesn't it? It's all contextual, it's all dynamic, and I've discussed this quite a bit with some friends, actually, Martin Billing and Adam Dobson and Luke Todd and Alistair Beverley, quite a lot in this. And I'm quite fond of humor and using it, and I swear a lot. And I'm myself, and we talk about other things, but of course there are times when humor is not that suited. And in the same session with a patient, I can go from calling them "oi dickhead" to listen. Yeah, I know this is shitty. This is not good. This is serious stuff, and we have to work with it. So I think it's a tough question to answer, because it all really depends all the time, and it depends on who you are, who the patients are, where you are, hospital, so the clinic, outside, indoors, whatever. But my take personally is that you never can get enough humor.
It's interesting that you mention Alistair Beverley, actually, because I don't know if you've heard it, Martin, but I did a podcast with Ali around banter.
Yeah, you banter Hulk. Yeah.
Yeah, and we and we came to a similar conclusion. And Ali was saying, let's give ourselves the credit that actually, in many ways, we are master communicators. And we are really, really good at going into quite heavy conversations and then just using humor to pull it up for a moment, so that then we can go deep again. Because none of us can take being in that low place all the time. And, I personally find that that's often when people will shut down. And it's the point where you sense that that's happening, that you need the humor to go, okay, let's all take a breath here. Let's laugh. And then we can go back in. And I think you're right, Martin. And Ali was right too. It's a skill set that we need to acknowledge, that we're pretty advanced, even though we haven't got a certificate for it. I think, and your Facebook group and your Twitter feed illustrates that beautifully, that humor is, I think, a part of many therapists' life, and we use it well.
But it has been ignored, hasn't it? In when I graduated, at least, I got a lot of yelled at from my teachers before. They called me unprofessional. You can't say that, you can't do this. And especially after exams, when you had patients examples and live patients coming in, and I always just couldn't quite understand why I got chewed out, because he was laughing, wasn't he?
Yeah.
The whole hour. So why is it bad? No, you can't do that. You're a physiotherapist. I don't want to be a physio anymore. But of course, it has taken me a couple of years to finally accept that and just be myself. And I also, what was it I wrote to you on Twitter, that finding that I'm not always right. I can fail. I can be myself. I can do everything. Also eases the burden of responsibility a little bit, because I can only control one or two factors in the whole process. And those aren't really big factors either.
Yeah. And just whether it's with humor or not, as you say, just bringing it out in the open normalizes it and takes the sting out of it. I kept that particular scenario inside for a long time, and because I maybe wasn't as skilled at processing things then, but bringing it out, talking about it, seeing the funny side, seeing that other people do it and see a funny side too, I think it's really, really helpful. Flic, sorry, go on. Oh, can't hear you, Flic. Something's gone wrong with your sound.
Is that any better?
Yep, that's better.
Yeah. That unprofessional label terrifies me through use of humour. Like, I love a good joke, but I do feel like when you think, professional physio, you think, I've got to remove all the exclamation marks and mute the colours and not joke. Because and it's not because I think I actually am being unprofessional. I think, what if other people see that and then label me as unprofessional? And I have certain individuals in my head who are doing that as I delete
to a jury.
Yeah, totally. Do we need to redefine what professionalism is in physio? Yeah. Because as Martin says, the patients are often laughing with, we're certainly not discussing poking fun at a person. But it terrifies me to be labelled as unprofessional.
But Flic, you are quite honestly one of the funniest people I know, and to think that your patients might be deprived of that sharp wit is heartbreaking.
And that's the thing with patients. I totally will be very dry and in that appointment. But I think if I was to then describe that after, it would completely put me off, because people might think, oh, it's very, very unprofessional.
Yeah. So that's interesting, isn't it? My question starts off as, what does it look like to live without failure, which obviously is a trick question.
We derailed from that one, didn't we?
Yeah. So
just no one wants to answer that.
Who's going to answer it? Who's going to go for it? We had a lovely conversation about humour.
But I think, Joe, that is just it. I think it's the fact we're not perfect, and all of that is okay. So I swear like a trooper with my rugby boys, because actually if I was very prim and proper with them, they probably wouldn't respect me in the same way. And I love the fact that I can have, very much boundaries are in place with them, but we can have a really good laugh, and I can swear around them, and that's okay. And it's almost kind of part of the role that we play. But like Flic said, almost frowned upon still to have those types of relationships with athletes, patients, whoever it might be, even with colleagues, like not being seen to be, doing daft things. Well, we're all human, and why shouldn't we have relationships and friendships with the people that we work with? And I think that's all very much part of failure, because we're all held up on a pedestal of how perfect we should be. And I think it's okay. I think perfect is being funny and doing human things and making human mistakes. So, I think that conversation was probably very much the same. Just what actually would it look like to be allowed to be normal and not be held on that pedestal?
Yeah, fair call. Good answer. All right. So we're drawing towards the end of this episode, and I'm going to give you three a little bit time to think about this question, because I'm going to ask you in a moment what your kind of failure takeaways are, and I'm just going to share mine in this moment. It may not be my actual takeaway, but it's the thing I'm thinking about at the moment, and I'll give you guys a bit of time to think while I'm talking. But largely based on things you guys have brought up, actually, I would say for me, at this stage in my life, one of my biggest failures is not to be brave enough and to function in a way that is constrained by the fear of failure. So I am someone that just is quite drawn to pushing boundaries on things and not wanting to do things in the way that I've been told or that everybody else does. And I always want to nudge things. And so I think I do whoever I'm with a disservice if I stay really small and, as we've talked about, really polite and always say the right thing, never say anything controversial, never show up in a way that might be slightly unexpected. If I take that route all the time, then for me that's the biggest failure, and it comes about precisely through fear of failure. So I think my takeaway is, yes, be aware of your responsibility. Yes, be aware of, in theory, the worst case scenarios, but don't allow that to constrain the magic of what comes out when you can just let it flow. With, as Katy says, mistakes and swear words and bad decisions and bad outcomes sometimes. I think the fear of it is worse, and not being brave. So would anybody else like to share their failure takeaway?
Like I'm all in on that. I'm like, yes, Joe, yes, that's brilliant. And then if we wrapped up this podcast, I'd be like, anyway, yeah, best remove some of these exclamation marks from my latest, Instagram caption on my FT physio. Because I still don't believe that everyone is going to be as forgiving. I feel like you absolutely should, but I also hope people are listening and thinking, oh yeah, maybe let's give each other a break as well, rather give ourselves a break, of course, but give our colleagues a break too.
That's against the rules on social media, isn't it?
Yeah,
you have to read everything
at face value, and in that moment you have to
so you can't
condemn it.
Yeah. No, we're not getting anywhere here, are we? Oh, failure, I think you're spot on, Joe. Actually, I'm agreeing with Flic and you about this takeaway on what failure is, and the being able to accept that we feel dread, we feel like we feel responsibility is a big part of acknowledging that failure is common, and that will help. I think that would help a lot of people. Just because it's okay. It's okay to be cocky. It's okay to be good. It's okay to be bad. It's okay to be sad. It's okay to be glad. It's okay to cry, which you Brits quite tend to be a little, I won't say it, uptight.
Gonna make us cry.
I cry with my patients. I laugh with my patients. I get angry in front of my patients. I even had a farting contest with one of my patients.
Nice.
You know, is that a failure in some way? Yeah, maybe. I don't know.
Depends if you won or not.
Oh, well, yeah.
I kind of pushed too hard, so.
Oh. Can you raise that from farting competitions, Katy?
Absolutely not, I'm afraid. I think for me, embracing failure, accepting that it's part of being human, because it's not something I'm very good at the moment. If I fail, I think that, that's not good enough, but it is, because it's part of being just who we are. So for me, it would be embracing it. And with that, embracing then your successes, because I also think we're not very good at embracing those, and actually going, yeah, I did a really good job on that today. And the next day then maybe not so good a job, but that's okay too, because that is just life. So yeah, I think my summary would just be to embrace it more. Feel the fear and embrace the fact it's there anyway, because it's part of being human.
Yeah, you're right.
Yes.
Your point about success is so right, Katy. And if the failure is looming large and that's all you can see, then you forget the success, don't you? And Flic, with the instant judgment thing, this is going to sound so holier than thou, and I apologize, I can't think of a better way to deliver this that isn't going to sound like that. But if we take that the only person's reaction we can control is our own, straight away when you look at those exclamation marks, essentially it is our own judgment, isn't it? It's you that's going, oh, those exclamation marks are a bit, whatever it is you're thinking.
Yeah.
So maybe another takeaway is to forgive ourselves first, and as Katy's just said, not just for the bad things, but forgive ourselves when we want to shout about our success and when we want to go on Twitter and say how amazing we are, or whatever. Forgive ourselves for that too. And I think you said it, Martin, too, for the good and the bad and the joy and the brilliant and the rubbish, because there's judgment available at every step of the process, isn't there? So maybe sometimes just to go, yeah, I'll pass on the judgment just now.
I think I say this to people with pain. I have a presentation that I've delivered about persistent pain, and the last slide is, and if you can do all of this stuff right, you can follow all of this advice, and there are going to be days where you have a really rubbish pain day. It's going to go wrong, and the picture of, it's topical again because it happened this year again, but there's some daffodils with snow on them. Sometimes it snows in April, but that doesn't mean you shouldn't plant your bulbs, or we can't just dread the fact that that this downer is going to happen. And the aim of the slide is to say you can do everything right, but have a bit of self-compassion and forgive yourself for when it does go wrong. But I find that very difficult to follow myself. So
I was going to say, can we just flip that side?
Yeah.
I just heard that snow in April was unusual.
Right.
I'm seeing out the window, it's snowing.
Is it? Oh. We definitely had snow in daffodils last week, didn't we? It was
that anecdote, it won't work in Norway, Martin. It won't translate.
Oh. Thank you so much, all three of you. That's been a really honest conversation, lovely conversation to have. It still feels like it's part of a a growing conversation that, let's hope it continues. Martin, you're doing amazing work. Forefather of Failures, keep going. If you're not on Martin's Facebook group already, then go and join and look at him on Twitter.
But I'm actually throwing all of you out because you've now turned out to be wiser than you led me to believe. So it was nice knowing you.
Oh, well, yeah, it's been a real pleasure.
But maybe Flic can stay in because she did miss an Achilles rupture, and that's pretty shit. We can't forget that. We can't let that live.
I think that's a good place to finish on that level of agreement. Absolutely unforgivable.
Hard judgment.
Yeah. No number of exclamation marks going to get you out of that one, Flic. Sorry.
If you could just chant me out with a shame chant that.
Yeah.
That's fine.
Well, that's one option. Another option is, can I invite all of you to just share if anybody has been interested to hear what you're saying? Is there anywhere that you would like people to get, or any way you would like people to get in touch with you? Let's start with you, Martin.
Oh, I'm just on Twitter.
No, you're not. You're on Facebook as well.
Yeah, well, yeah, in that group, I am. So if you want to join the oh shit, I forgot what we called. The Society of...
I love that failure.
If you want to get in touch with me on Facebook, you can just join the Society of Average Physios and Failures. On Twitter, you can just search for Martin Christensen. I don't remember my Twitter handle.
Twitter handles are not.
I'm in. If someone wants to talk with me or reach out to me, go for it. I'm in paternity leave. I don't have anything to do except play with the baby on the floor, and I'd rather. Oh, this will sound bad. I'd rather talk with someone else.
We're all judging you in this moment.
Yeah, I felt that.
Basically, Martin is available for a chat on any platform for the next 19 weeks.
Give me a call.
Excellent.
And I love your Twitter handle, Martin. I found your Twitter handle.
You did?
Yeah. @Martin_Nicolai.
Ooh.
That's brilliant. Thanks, Flic. It took me 7 podcasts to remember my own Twitter handle. I got this rabbit in the headlights look every time someone asked me at the end, don't worry. Katy, how can we get hold of you?
So I am on all social media pages, even though I hate social media. So you can find me on Twitter, KS Bouncing Back. Bouncing Back is the name of my injury clinic. So you can find me on Instagram, Facebook, and I'm always willing. I'm definitely a face-to-face person. So anyone that's based around the Southwest who wants to get a coffee and have a chat about failures they've made, drop me a line and I'd be more than happy to meet up in person.
Thank you, Katy. And Flic.
You can send your shaming and judgments my way on Twitter @FelicityThow. And if you want pictures of daffodils with snow on them and musing captions like that, I'm @FTPhysio on Instagram.
Marvellous. Thank you so much, all of you. I hope you make some fantastic failures for the rest of today, and enjoy them and embrace them. And thank you so much for being guests.
Thank you, Jo.
Thank you.
Take care, guys. Thank you for listening. I hope you enjoyed that panel discussion. I promise you that was achieved with no edits. We decided to keep everything in, and as far as I'm concerned, there was no need for any edits. It felt like a great, honest discussion, and it felt like we moved the conversation around failures a little bit further. I think there's still a long way to go with it, but it feels good to have nudged it a little bit further down the road. So if any of these topics interested you, if you identify with any of the traits or the feelings that we discussed, these are things that come up an awful lot with coaching clients, these feelings around failure, the traits of perfectionism, how we come to terms with these things, how we live with ourselves and keep going, as we discussed on the podcast. They're things that come up all the time with coaching clients, and If you identify with some of these things and you'd like some support with them, then as ever, book a call with me. You can go onto my website, mehab.co.uk, and book a call straight off there. I'd be more than happy to have a chat with you and see if there's any way that I can support you. In the meantime, have a lovely weekend. Enjoy the rest of your Sunday or whatever day you're listening to this podcast. And remember, if you're a busy clinician looking after people in all areas of your life, all day and every day, then do stop, turn the care mirror around the other way, and remember to look after yourself, because you matter.